Hello, everyone. My name is Xander Chawi with One Place Physical Therapy. I'm excited to introduce our new series, Best of Sarasota. In this series, we spotlight the top healthcare and fitness professionals in our community. They are truly making a difference. Today, our special guest is Michelle Birch. She is a certified registered nurse anesthetist and is a functional medicine practitioner. Michelle, it's so great to have you here. I just want you to give a quick background on how you started your medical journey.
So quick background how I started my medical journey. I've been in healthcare for over 20 years. I started as a registered nurse working in the intensive care units. And then I pursued my master's degree in anesthesia, became a certified registered nurse anesthetist. I worked doing anesthesia in a multitude of different settings: outpatient surgery, plastic surgery, orthopedics, trauma, burn, neurosurgery, all those things. I primarily specialize in cardiac anesthesia. I've been doing that probably about the last 6 or 7 years. I really enjoy the cardiac aspect. What led me into the more functional medicine side is just patients struggling with their health and wanting more options, and then also my own personal family members having different issues and seeking something more than just a pill for antidepressant and things like that. We want real solutions and more preventative. And then my husband and myself were very active, and we want to stay that way as we age, and we want to age gracefully and just really stay as well as we can and optimize our health as best we can, which that's what led me into the whole functional medicine aspect. I really got into it for peptides, to learn about peptides and get certified doing peptides, honestly, to treat myself and my husband, but then found a whole nother avenue of really just mind-blowing research about how just functional medicine and all can even help in chronic conditions and healing purposes, and even neurologic disorders and mental health problems. And we all know we have a kind of a crisis of all of those things in our country today. So.
It gives you so many more tools, like in your tool belt. Working in anesthesia, you only have so much control over the patient's health, but this gives you so many more tools to benefit their mental health, their physical, literally everything. One major tool that you have is this glutathione. Go into more about glutathione and your practice and what makes it such a powerful tool for you.
So glutathione is like the master antioxidant. Imagine it like our own little Roomba that runs around constantly and cleans up all the toxins and debris that we just kind of have floating around in our bloodstream and our organs. It really helps detoxify, helps your liver detoxify. It's really a great anti-inflammatory, which we have inflammatory mediators from everywhere, all over our bodies. It helps with healing and recovery. It's great for your skin. It helps with decreased lactic acid buildup in your muscles for those of us who are, working out and really pushing our bodies to the limits, athletic performance and things like that. It just really helps from an overall wellness aspect because of the detoxification, antioxidant, and anti-inflammatory properties that glutathione has. Now, we all have glutathione naturally occurring in our bodies, but as we age and as we're exposed to toxins and whatnot in our environments and diets, it decreases significantly. So supplementing with glutathione can really give you a boost that you honestly sometimes don't even know that you were missing,
Right. And, toxins are part of everyone's body. And yes, when you're younger, you have more of this resource to use, but as you get older, you don't have that resource to combat all the toxins in your body. And yes, like you said, we just kind of live day to day and we don't realize we're battling all these things in our body until you finally take glutathione and you realize what you're missing.
Yes.
So yeah, such a great tool for combating the toxins. And then you've also mentioned NAD as well in your practice.
Yes, and I think that's a new buzzword, right? Everybody's kind of
Yes.
asking what about NAD and glutathione. So NAD is nicotinamide adenine dinucleotide, which is a very, very long word to say. Same kind of concept, though. We all have NAD naturally occurring in our bodies. as we age, again, it tends to decrease. How NAD works in the body is it works at the mitochondrial level. So basic science course is mitochondria is like our powerhouse of our cells. It's where all the energy for each cell in our body is produced. And so the NAD allows for more cellular energy to happen at the mitochondrial level. What does that mean in real terms? Well, that means that it's a great anti-inflammatory because of the cellular regeneration. It causes DNA repair. It helps with redox and production, and so it helps like the glutathione kind of clean up our cells. But that activity at the mitochondrial level is really important, and that's really how that NAD functions primarily. It is great in all things chronic disease, especially in autoimmune disorders because of the anti-inflammatory properties that it does. And then also anything pretty much anti-aging because of, again, the cellular energy that is allowed at the mitochondrial level by keeping your NAD levels high and supplementing.
Right. That's where all of our energy, comes from, is the
Yes.
mitochondria. At the
Mm-hmm.
basic unit, it's from the mitochondria. So if you can somehow stimulate that powerhouse, it's literally called the powerhouse of the cell. If you can stimulate that on a more systemic level, you're going to see improvements in cognition, your energy levels. I know that a lot of people that I've talked to that take NAD have this like very sharp awareness, almost like if
Mm-hmm.
you had great caffeine and you're just like in that really sharp awareness zone.
Yes. So for me personally, it's really that afternoon kind of brain fatigue that I was feeling. So I always needed that like afternoon cup of coffee or some sort of maybe a Celsius or some sort of energy drink that to try and keep me going because I just felt mentally fatigued. Once I started doing the NAD, I don't have that mental fatigue. Like it's just gone, and I don't need that extra cup of coffee or that extra caffeine towards the afternoon or the evening time. And I just feel more clear-headed. It's almost hard to describe the feeling because it's such a subtle feeling. You're just like, wow, my mental fatigue is gone. I just don't feel mentally bogged down in the afternoon and the evenings anymore, like I did previously.
Yeah, a lot of people
Um,
talk about, the brain fog,
yeah.
especially
Hmm.
in certain chronic mental health conditions. It's just like, man, I just can't think straight. I'm forgetting things, and
Yes.
this
Hmm.
is all part of that same process. So, what have you seen in certain medical conditions where it's like just totally game changing when people start supplementing NAD and glutathione?
So, in particular, in autoimmune disorders, whether that be like a rheumatoid arthritis or Crohn's disease, I mean, there's a multitude of autoimmune disorders out there, long COVID in particular. Um, people are, I mean, they'll still test positive for their markers, but they'll from being symptomatic to being completely asymptomatic, which is pretty phenomenal. Because there's really no prescription drug out there that's doing that. There's no treatment that's allowing that. And now, as compounding pharmacies are getting better at different modalities as to how to receive. And it used to just be involved in a IV infusion, which is still required for a really acute phase. And obviously, if you have rheumatoid arthritis and I'm symptomatic, I'm going to do an intense therapy of IV infusions over a set period of time, then transition into more of a maintenance phase. But for those of us that are just looking for, maybe I'm going to have an outpatient surgery procedure. Maybe I just want to I want this mental clarity. Maybe I'm experiencing that mental fog and I don't want to have that anymore. And I need something to kind of keep me daily, keep my NAD levels up and whatnot. They have a nasal spray now, compounded. That's very, very easy. That's what I use. I can do it every day. It's very, very simple to use. I can carry it with me. But then for those people who don't like to do things every day, there's also, you can do NAD and IM injections. You could do it twice a week and different. So there's different modalities as far as for each of us that are in different stages. If we're in acute stage of our disease process, or we're just wanting maintenance, we just want to maintain, we want to, the anti-aging effects. then there's certainly, different modalities that are easier to take on a daily basis. Again, I like the nasal spray. There are some other things that you can do that help increase your own NAD production. High intensity interval training is one of those. Infrared sauna is one of those. So in a combination of all of those things, I think is the best benefit, obviously, the synergistic, where you're supplementing it, but you're also doing those things that allow your own body to increase its own production, is where
Right.
you're going to see the biggest benefit.
Seems like there's so many different supplements and avenues you could take, and
Hmm.
the infrared sauna you just mentioned is another added benefit.
Yes.
Talk more about the infrared sauna with recovery. I know that we do F45, so we love that recovery
Yes.
aspect after a heavy workout. So
Yes.
describe the benefits of infrared sauna.
Yeah, so infrared sauna works on wavelengths of light versus heat. Now it does get hot, but it's not like a typical sauna where it's just heating of the air. You're actually heated from the inside out. So these infrared and near infrared light wavelengths can penetrate deep into your muscles, through your skin, into your joints and bones. So they really help with pain relief, again, anti-inflammatory properties, which help with healing. They cause vasodilatation, right? So increases oxygen to tissues, and that's how you get the healing. And then also you can offload the toxins that have built up there, CO2 release, all those types of things. It helps to tighten skin and helps with collagen synthesis and production. Again, that also is a component of the healing process that infrared saunas are really, really great for. And the really high end ones, they have like different programs. So like I mentioned, pain relief, it's going to be a set different wavelengths for a set time at a set temperature. So lots of different modalities, even within the infrared sauna spectrum of treatment for different current problems that you're seeking. The recovery one is really great. It doesn't get quite as hot as some of the other ones, but the penetration is great. It helps relieve that lactic acid from your muscle builds up, so you can come right back the next day and be ready to do a nice heavy workout again.
So you have all these different tools,
Hmm.
and how do you determine like what the root cause is? What's the right supplementation that you need to do? Are there certain like tests, like blood tests that you need to do to identify what is actually needed in this scenario?
Yeah, well, a lot of symptoms kind of overlap, right? And they can be very vague, especially when it's minor stuff or it's just related to aging or whatnot, right? I think fatigue and mental fog, GI problems, those are all kind of pretty common symptoms across a large band of different causative factors. So you definitely have to look at what you're feeling, what your symptoms are, but you have to really know what's going on inside the body, you have to take a look, right? So blood work is definitely important. You want to know, what all your blood components are. You want to look at your thyroid. You want to look at your hormones. You want to know what those are. And you don't, and that really leads you to supplement according to what is going on with you. Every single one of us are very different, and we have different chemical makeup inside of us, even though we're all very much the same. But what will work for you might not necessarily work for me, even though we're maybe having the same kind of disease process, right? So you to really find out, and then in labs and things have really gotten so you can micronutrient testing, microbiome testing, and you can really go. Obviously, the genetic testing is just getting more and more. I feel like every day there's this new awesome test that is going to tell us even more. And just the thyroid alone is got like 5 tests now that before they would test like 1 or 2 things, but now I'd like to really see your whole thyroid and really what's working, how it's functioning or how it's not functioning. It's like 4 or 5 tests, which is pretty interesting to me, how we can really move on. And we can do saliva, we can do serum, we can do urine metabolites, and that is really going to give you the best picture of what is really happening at every cellular level of your body, right? So to really dive in deep and really know, which I would highly recommend especially if you have some sort of really chronic disease or you're in some sort of acute disease and you're trying to figure out, why am I feeling this way? You really got to go deep and find out what's going on at a cellular level, and then start implementing different things according to those lab values.
That's so important, and I think
Hmm.
it's great that we have all of these tests out there now.
Hmm.
It does get a little overwhelming for someone who's not in that field.
Yeah,
I'm a physical therapist myself, so we don't really like prescribe, medical testing and things like that. But that's where you come into play, is kind of directing based off the initial symptoms. Maybe you should get this test first. Let's start here. This is a good
hmm,
starting point, and then branch off. So it's important to have a functional medicine practitioner to guide you because there's
it
so many
can be
different
overwhelming,
conditions.
yes,
Yeah,
and confusing, yes.
yeah.
Hmm.
So you can be a great guide to people to understand their symptoms. Why are they feeling this way? What test should I get to take the next step?
You can just start some basic stuff. If you're taking no vitamin supplementation, sometimes it's just as simple as adding some vitamin supplementation, and you feel completely better. Not saying that you shouldn't at some point have your labs checked and find out what's going on, but if it's just say like, I'm feeling some fatigue, I just don't feel like myself, I can't work out as hard as I used to, or whatnot, you can start with some basic stuff. You can just start with some basic supplementation, basic symptomatology, and then also like, where do you want to go? Like, what's your expectation for treatment? What is it that you're wanting to change? What is it that you want to see a difference in? And that kind of helps guide you as far as not only the treatment plan, but the supplements as what you need to do. And sometimes just starting you on some simple, 3 or 4 vitamins, and you're like, man, I feel like a different person. And that's probably what all you needed at that point. There's really no point to go too much further, until you have other issues.
Right, start simple. So
Yes.
what are the initial like core vitamins or minerals that people need to just be aware of? Is it like magnesium? Is it calcium? What are the kind of the core ones to start with?
So predominantly, a lot of people are deficient in vitamin D3. And you think, well, we live in a sunny place, and why is so many people deficient in vitamin D3? Well, vitamin D3 is actually the only vitamin that our bodies actually make themselves. So that should tell you right there how important that one vitamin is, right? Like, there's a vitamin D3 receptor pretty much in every cellular organ in our body, right? So it's very, very important. Well, how is vitamin D3 made? Well, it's made from sunshine, which we know that it comes from sunshine, but it's also made with cholesterol. So the combination of those two things is how our body makes vitamin D3. It's very important in so many things, not just like neurologic things, but also our mood, and which I think people don't think about when they're having anxiety or mood problems, a vitamin deficiency, but that could very well be a solution. And then the darker your pigmentation, so the more natural melanin you have in your system, genetically speaking, the more deficient in vitamin D3 you tend to be, because you have more pigment in your skin, so it protects you more against the sun, so you don't absorb as much as someone who has much lighter pigmentation. And so really, really important for you to supplement, or to at least know where your level is, and to supplement vitamin D3. It's important for your bones, it's important for your blood vessels, it's important for your brain, it's important for your mood. And so I think vitamin D3 is a very important vitamin. The B vitamins. B vitamins are important in pretty much all cellular functions as well. I think we all relate B12 to like weight loss and metabolic things, which is true, but all B vitamins are important in our metabolic function, again, at the cellular level. They're also really great in inflammation, and increasing tissue healing, and collagen synthesis. So, a complex B vitamin is very, very important. And then magnesium, as you mentioned, is very, very important. Magnesium is great, again, for bone density. It's great for sleep. It's great for cognitive function. It's important in muscle recovery, for post-workout or post surgery. It really just helps with all kinds of different things on a cellular level, and pretty much all of our body as well. If I were going to take 3 supplements those are the three I would take.
The magnesium, the B supplements, and the D3.
Yes. Uh-huh.
Yeah.
Yeah. And
Yes,
I would
that,
do
that
a
would be a great.
complex, not just a
Yeah,
complex, a B complex, not just B12.
right. It's the. I
Yeah.
mean, there's so many B
Yeah.
vitamins that
Yeah.
you don't want to focus on B12 and then
Hmm.
miss the whole spectrum.
Yeah.
That would be such an easy place to start. Is
Yeah.
start with the supplementation. It's so easy, and
Yes.
then see
Uh-huh.
if you have any improvements. If not, then we have to have the next conversation of maybe there's a certain test we need to take and see what's going on.
Correct. Yes. Uh-huh. You can always start simple and then you can advance from there. So I think some people can follow simplicity as much, and then you can build on that from there, versus trying to like do something really major and try to take all these different supplements and start doing all these other things. I highly recommend, even with the glutathione or the NAD, I do them both, and I recommend them both. I think they're really great. Obviously, they work synergistically together, but they're very great independently. But I would never recommend for a client to start taking them both at the same time. Why is that? Well, because you need to know that one is working for you and that you see the benefits from that one that you're taking. And then if you still haven't reached the end result or the expectation that you're really wanting to get to, then that's when you add in the other one. And I think that's how you manage and you do a treatment plan that is going to work for you. Because the last thing you want is to buy all of these things and then it be so overwhelming that you just don't take any of them. So because then you're not benefiting yourself at all and you've just wasted your money. So I think it's important to stick to a plan of something that's easy to follow and something that you can do, and that you will do, because it takes compliance to do daily to really see the best benefit and the most long-term benefits.
That is such a smart approach because a lot of people screw up and they just take a bunch of vitamins, they take all these medications. Maybe they're feeling a little bit better, but they have no clue what actually made that change. And
Yes.
it's the same for PT as well. If
Hmm.
you come in on your eval and I give you 12 different exercises and you feel better, you feel worse, I have no clue which exercise might have caused more irritation or might have made you feel better. It's important to always start slow,
Yes.
small,
Hmm.
see how you improve, and if you're headed in the right direction, keep pumping it out. If it's not changing, then you know you need to redirect. But yeah,
Exactly.
you
Hmm.
don't want to overload yourself with all these different things because then it does get very, very overwhelming.
Yes. Well, and two, just as important as not being deficient in these vitamins and minerals is that it's also, you don't want to be you don't want to have too many of them either, because too much is just as dangerous as not enough, right? Our bodies are optimal, in a balance, and so that's where you want to stay and that's where you want to shoot for. So that's also something to think about and consider as you're starting this journey, and then as you progress through this journey as well. So
Definitely.
again, that's where checking your labs again later on, your symptom, you may feel better, but you want to check them just to make sure you're not over supplementing. You want to make sure that you're staying within the optimal range for your body, because too much can also be dangerous just as much as too little.
Before we close out today, I want to talk about the future of functional medicine. What are you excited about the transition of the current, medical model into more of a kind of a functional medicine mindset where
Hmm.
everybody's kind of on this trend of focusing on supplementation, focusing on the things that we can change. Are you seeing a trend with the standard practice into functional medicine? Is that going to be the future?
Well, I think from a patient standpoint, yes, I feel like more and more people are asking about other things outside of conventional medicine. Now, conventional medicine will always have its place, for sure, but in conventional medicine, there's still this opposition to the functional medicine aspect of it. But I'm super excited about. We kind of touched a little bit about how like the labs and like all the testing and how just incredibly detailed that is becoming. And 5 years ago that wasn't a thing. So that is really really exciting. I mean, it's like tailor made essentially for each individual person. And then also the new things that are just coming out that you can do from a functional medicine procedure standpoint. It's just super exciting, like all these things, and they're really mind blowing at the results that they're having. There's this thing called EBOO where they essentially like drain your blood out and pump it back in. It's filtered out with ozone and oxygen therapy. And I mean, they're removing plaque and protein spikes, from COVID vaccines and COVID viruses and the herpes virus. I mean, just all kinds of chronic diseases. I mean, it's pretty impressive. I am hoping to see that with this push that patients are taking more assertiveness in their own care, right? Like they are asking those questions. They are wanting to know, what can I do outside of this that's going to prevent me from getting sick, that's going to help me change this chronic condition that I find myself in, that's going to help me age where I'm more optimal in my health. And I love seeing patients take that initiative to just want to be in tune with their own bodies and in tune with what they can do, and finding the research and the science, because it's out there and it's happening. And the more that patients seek that, and the more the patients require that from even their conventional side, the more functional medicine and the peptide aspect will continue to grow. And I just think that's great. I think each and every one of us should want to know, why do you want me to take this medication, and what's something else that I can maybe do instead of taking this? Or just being in tune with our bodies and knowing that when something's not right, our bodies are really beautiful things. They are really designed to heal and to heal themselves. They just need the proper tools to do so. And so I love that this is a new kind of push and wave, and people are wanting to know that information. They're seeking that information and really wanting to be in tune with what they're putting in their bodies and why they're putting it there. And I just think that is the best from all of this, really. So
Yeah, me too. I'm so excited for it because it just gives the patient more power and authority over their body. They don't feel
yes.
like they have to take a medication or have to do a surgery in order to
Mm-hmm.
feel better. They have these tools that they can use at their
Yes.
disposal.
Uh-huh.
So it's just so empowering to people even like myself. I'm a practitioner myself, but I
Mm-hmm.
am a human being and I need to keep facilitating the right tools for my body. It's an
Yes.
ongoing journey. It's never, same thing with exercise. There's not
Mm-hmm.
like I do a bunch of exercise and I can
Yeah.
just rest.
Right.
No,
Yeah.
you got to keep
No.
this up, keep
Uh-huh.
maintaining the body. It's
Yes.
so important to have that mindset.
Yes. I agree. And to me, that's the most exciting thing that's happening right now is patients having that mindset of seeking that. And then, of course, the science is there and the science is happening. And, every day we're developing, new peptides or new modalities to take peptides that were once, you had to go to an IV infusion to get it or whatever. But because it is exactly what you said, it's about what you choose to do every day. It's not about doing something once a month.
Right.
So,
Constant
yeah,
maintenance.
constant. Yeah.
Awesome, Michelle.
So.
Well, thank you so much for today. If people want to get in contact with you, you're okay with texting and email. Is that okay
Yes,
for you?
definitely. I still currently am, full time in anesthesia. I'm kind of working on this on the side. I love it. It's my passion. So you have my number. It's great. Just shoot me a text and let me know you're going to email me. So I'll be looking for it. And that way, if you have more questions or you want to touch base, you want to, meet or whatever, just, yeah, shoot me a text and then I'll be looking for your email after that, and then we'll get in contact and go from there for sure.
Perfect. Thank you so much, Michelle.
Thank you so much.